Okay. Homeless has become a major issue, especially for Chicago. Many are roaming the streets with nowhere to go as a byproduct of current recession and a high budget cuts. As of July of 2012 analysis, the Chicago Coalition for the Homeless shows that 105,338 Chicagoans were homeless between the years of 2011 and 2012 during school years. This was a 12% increase from the previous year, 2010. Chicago Public Schools identify a record of 17,252 homeless students that include 3,005 unaccompanied youth in 2011, 2012, and a 10.7 increase from previous year's records. Currently, there's a deep freeze on housing assistance, and it started from budget cuts during Reagan years, which have used the deficit reduction as a pretext for achieving the elimination of government housing aid. Reagan infamously slashed the housing budgets at the time of recession. However, it just made the problem worse. Well, Congress as well cut the federal housing programs by $3.8 million. So, looking back at the history, most patients were released from mental hospitals in 1950s and 1960s. Yet the major increase in the homelessness was during the 1980s, when the income and housing options for those who are living in margins began to disappear. So currently, instead of fixing the problem, Obama administration officials have adopted the subpopulation approaches, and they focus more on homeless policy for the military veterans. This campaign was a goal to find 100 homeless homes in 3 consecutive years. Unfortunately, there is a small friction to what are the odds of the homelessness. There are about 3.5 million Americans who are homeless every year, which is what I actually found when looking through different websites is that one of the veterans he commented saying that just because he was serving in just because he was serving in the service, he still feels like everybody has the right to a home. Um, Anyways, nevertheless, homeless individuals with chronic hearing disorders, COD, of severe mental illness, are the most defeatless population. Individuals with chronic hearing disorders are more likely to be chronically homeless, and they are less likely to receive some kind of treatment to recover from an illness. There is a high number of mentally ill who are homeless. These people may be ending on the streets because they simply cannot afford to work or have the proper skills to maintain a regular lifestyle. Institutions for mental disease emerged in Illinois in 1960s and 1970s after the state began closing mental hospitals. Today, there are more than 4,000 people reside in 27 mental institutions across the state. However, there are less poor reputation and care for patients, and the professional staff is not adequate and does not provide full assistance that is needed. Um, there has been some research done for the article that I used in the paper um, by Lesa Sparovka and Catherine Tyson, who looked at 210 mentally inclined clients, and they were interested about the service that they were actually getting. And many residents strongly preferred independent living arrangements and envisioning having a partner and children, psychological support in their picture independent living. Researchers found that only one out of the two clinicians considered clients' living situation based on their background and medical status when making houses recommendations. Unfortunately, during our time, housing assistance works like a lottery. There are many slots that can be certain filled, that can be filled for certain individuals, and spaces are limited. It is estimated there are more than 3 times as many households are eligible for this scarce resource than receive it. There's a severe competition for the housing assistance. Unfortunately, the disabled, including those who are mentally ill, do not get the priority. They're required to compete against everybody else with a subsidy. In this case, might be slim or it's pretty much impossible because many not be able to apply for the program, and some may not even fully understand the concept of how to get such services. The number of people who actually get the benefits in housing programs are known because it's prohibited to ask the questions whether a member of an applicant's household has a disability. Many homeless individuals with mental disorders consider their homeless to be caused by lack of income rather than their mental illness. It is important to link the individuals to government entitlements and connecting with several programs that can support these people and give them the knowledge to better their life.
The issue of homelessness has rapidly increased amongst our nation because of the economic crisis that has been enduring throughout the years. Figures of homelessness have skyrocketed in the district the past 4 years, rising to nearly 12,000 individuals, 5,600 of which are families. Low-income families and individuals become the main target in situations as such. Those who fall through the cracks of society are being met with attacks on safety net programs at every level of government. The family homelessness has spiked 74% since the onset of the recession in 2008. However, many fail to realize that within the homeless population, there is a great amount of individuals with a variety of mental illnesses. While many homeless individuals as a whole, the reality is that there is a variety of populations amongst each other. Mental disorders are very common amongst the homeless population. According to the Substance Abuse and Mental Health Service Administration, 20 to 25% of homeless population in the United States suffers from some sort of severe mental illness. People that should be receiving treatment instead are out in the streets not only endangering themselves but others as well. In comparison, only 6% of Americans are severely mentally ill. There seems to be a significant higher amount of homeless people with mental illnesses roaming the streets unattended than in hospitals receiving proper treatment. There seems to be a higher amount of individuals with schizophrenia or manic depressive illnesses among the 74,000 homeless people that make up the population. Mental illnesses is the third largest cause of homeless for single adults. The homeless population, especially the mentally ill, has increased steadily since the 1970s. This is seen in all major cities, but also in smaller cities and towns. Mental illness may also prevent from forming and maintaining stable relationships or cause people to misinterpret others' guidance and react irrationally. This often results in pushing away caregivers, family, and friends who may force keep that person from becoming homeless. As a result, these factors and the stress of living with mental disorder, people with mental illnesses are much more likely to become homeless and generate that population. With such large amount of illness individuals that are roaming the streets, the government should form an intervention that can provide proper care to those that deserve the treatment. How are we supposed to thrive and be the best that we can be if there is no one helping those that are being affected? There has been several housing facilities that serve the purpose of sheltering the homeless, but that has been demonstrated of its act of its own that it is not enough. The city has recently reported that there has to be 7 million shortfall in its budget for services dedicated to fighting the homelessness. Serious mental illnesses disrupt people's ability to carry out fundamental aspects of daily life, such as self-care and household management. Maintaining a healthy living is a task difficult to accomplish to a majority of individuals amongst our society, nonetheless those that suffer from mental illnesses. Poor health and mental illnesses not only affect the physical but the mental as well. Minorities, especially African Americans, are overrepresented in this group. Some mentally ill people self-medicate using street drugs. Not only is the use of drugs another unhealthy factor, but it can lead to not only an addiction, but also disease transmitted from injection drug use. The combination of mental illnesses, substance abuse, and poor physical health makes it very difficult for people to obtain employment and residential stability. Mental illness may cause people to neglect taking the necessary precautions against any disease. When combined with inadequate hygiene due to homelessness, this may lead to physical problems such as respiratory infections, skin diseases, or exposure to tuberculosis or HIV. In order to consider a successful solution to abolish homelessness within the cities, there must first be proper measures to consider. There is a great amount of sources that can be provided to help the people within the government. The only problem is that there needs to be a larger amount of people within the public to be able to advertise what the solutions are actually being given. There should be no hesitation to providing a helping hand to those that need it, especially since there is a great deal of policies that are hard at work to decrease the number of illnesses within the homeless that are taking over our city.